Thank you, Mr. Wahlberg. Yes, I have just had 5 listening sessions around Northwest Oregon with healthcare providers, people in recovery, law enforcement, and of course, employers. I appreciate so much of the testimony here today and understand that work and our personal lives are so intertwined. Ms. Allen, thank you so much for setting that example. We have a business in my district, Beaverton Bakery, that has a second chance program. They work with our drug treatment court, and when we acknowledged them recently, I prepared for an onslaught of criticism, but the response was overwhelmingly positive. So I think we will see that as more and more businesses do what you are doing. Mr. Ryan and Dr. Andrews, you both mentioned drug disposal as important tools, and that's something that has come up in my listening sessions. There just aren't enough options for people. It's one important step. There are not enough options for people to get rid of their unused prescription pills. So can you please elaborate about the role that employers could play in providing a solution? And briefly, because I do have another question.
Sure. I think you can look at Walmart as a great example, and they have proposed offering these sites both for their employees and for customers as well. And so I think employers absolutely can step up to do that, because you're right, not all local police stations have this. I know many do, but certainly many don't. And
not to interrupt, but with a lot of people, a lot of my constituents don't feel comfortable walking into a police station saying, I want to get rid of my unused drugs. I have a significant Latino population, minority populations, that they're just not comfortable walking into a police station with drugs. So we have to have alternatives for people to get rid of those pills. Dr. Andrews, do you have anything to add?
I think that this is an incredibly important issue. Safe drug disposal must be an important component of prevention efforts around the opioid epidemic. I think that, integrating safe disposal into places like pharmacies, primary care, places that are not either stigmatized or present criminal threats, and allow people to feel comfortable getting rid of those unwanted drugs is really key.
Thank you. Those are logical. I want to move on as the clock goes down. Mr. Ryan, you mentioned parity for coverage of behavioral health, and one of the issues that has come up frequently is alternative treatments. We have at our Oregon Health Sciences University a great pain management clinic, but oftentimes alternative treatments, whether it be physical therapy, massage therapy, acupuncture, they're not covered. And so they're not prescribed, and instead opioids are prescribed. So are there good reasons for employers to make sure these alternative treatments are covered in the plans they offer, and how could we expand the number of employers who are doing that?
Yes, absolutely. Employers should be involved and engaged in the insurance that they're offering to their employees and making sure that these alternatives are available. I think we've realized the risk of prescribing an opioid for chronic pain and the risk of addiction that occurs from that is very costly to that employer. And so making these alternatives available has a potential to save that employer money and is a better option for the employee themselves.
Dr. Andrews, anything to add?
Yes, I would add to that there's research that suggests that opioids are not effective for chronic pain management, and that we have to start funding both services as well as medications that are going to be more effective.
And Mr. Ryan, I've heard about sometimes fear of job loss or income loss. Somebody with a substance abuse disorder might delay or forego getting treatment. So how could comprehensive job-protected paid leave allow workers to seek treatment and support those in their family who may need treatment?
I think both of those options are very important. The evidence that we've seen from Lorain County and the other work that we've done is that employers that offer those programs tend to see very positive results from those cases. And certainly I think you can give examples as well that shows a strong benefit and is good for all parties.
Thank you. And again, Mr. Chairman, thank you so much, and Ranking Member, for holding this hearing. It's been very informative, and I yield back.